gorilla in the room is electronic health records and how they have transformed the practice of medicine. There are many doctors who believe that that this is wonderful, and there's probably an equal number of doctors who feel that this has been an incredible intrusion, and they're spending more time at the computer than they are at the bedside, and that's a huge discussion. You add onto it the sorts of things that Brenton and I are doing with big data and health analytics, and you add to that what government is doing, you almost worry, will there be information overload and will it just shut the operation down? Because you still have to see the patient, touch the patient, do something to make them better, right? And that takes time. And time is the only thing that's not fungible here, unless you go really fast, right? So, you know, Brenton, you're an expert in this, and you're spending your career on it now. How do you see, in a positive way, the whole, not just the area you're working on, but the entirety as a practicing doctor, information technology changing how you practice medicine?
Yeah, no, that's a great question. As you were mentioning, electronic medical records to date have historically been used as a historical chart, facilitation of billing, documentation for malpractice, things that don't necessarily get doctors very excited about taking care of their patients. And so I think right now with alternative payment models, we're at an inflection point where the electronic medical record can really move beyond becoming that kind of receptacle of information in terms of being able to pull out in structured fields information, performing analytics on that, and then bringing that back into the point of care at the electronic medical record. I think a lot of things we see today with alternative payment models is there's new requirements, and there's a lot of different technologies that physicians are trying to patch together to work with it. So they'll open up a pathway portal here, they'll open up a patient reported outcome portal here, they'll document their note. And what happens in those circumstances, as you know, we're practicing very under time constraints, that those become relegated to back office tasks if there's friction with the technology. So the first piece is making it frictionless and part of that workflow. And then it does create the opportunity to really leverage information across a clinic. So you can see at your clinic who are the types of patients needing more care, who are the types of physicians who are providing highest quality care, but even more importantly across the country, and being able to benchmark and unearth whether it's for clinical research or for practice transformation lessons, what are the best ways to be treating our cancer patients. And I think that's what gets me excited, what gets a lot of physicians excited about the future of technology, but we need to very quickly move beyond the EMR as a receptacle of information and instead as a vehicle for higher level data analytics that can then be brought back to the point of care. And with alternative payment models, there's certainly the opportunity being set for that.
So Rena, you know, add to that whatever you'd like, but I'd like you also to focus again from your area of expertise on the whole idea of, you know, right now, I'll just say it in a general way, we're really trying to move people away from fee-for-service gradually, and it's something a lot of people cling to because they're comfortable, as you alluded to before. And we're in this intermediate zone where we're trying these things like pathways and OCM, and you can actually pick those apart pretty easily about whether or not they really are going to bring value to the ecosystem. And ultimately, everybody wants to pay for outcomes. I mean, the FDA approved drugs based on outcomes. You shouldn't get, you know, a huge check if your drug didn't work. The doctor, if they do something wrong, shouldn't get rewarded for that. So it's really going to go to outcomes. So how do you see, and this is heavy IT, this is IT intensive to be able to do this at scale. Where do you see this residing? Is this going to be from the private industry coming up with novel solutions like, you know, I'm not saying in particular, but just an example. Apple changed the way we think about phones, as an example. Microsoft changed the way we thought about typewriters. Is it going to come from something like that, or do you see this really, because it's healthcare, the role of government, and will government start providing big data initiatives and things for people to use, and it won't be from the commercial? How do you see it playing out?
Yeah, so I'm a big believer that the private sector will come and find solutions to these problems now that they're identified as problems that need solutions. And I think for a very long time, the medical providers have been comfortable in a space where they're practicing using paper records or electronic medical records that are kind of not really very smart machines. We're moving away from that. There are some practices that are in the vanguard of that. There are some companies that are in the vanguard of that, but I think we're going to see a lot more innovation in this space. We're certainly seeing a lot of investment in tech moving towards medical sphere now. One thing I want to point out is that right now our existing EMR systems are very siloed. They sit in medical practice or in a hospital, but they really can't talk between one provider group to another provider group or a hospital to a provider group in the community. One of the things that I'm really excited about is that really government needs to kind of allow this siloed behavior to stop and create incentives not for providers or for hospitals to hold on and hoard their data, but instead to create win-wins where these type of information systems can start to talk to each other between inpatient and outpatient setting or between your oncologist and your diabetes provider. That's going to make a big difference, I think.
Once again, I'd like to toss this over to Dr. Sagar and get her opinion on the subject.
Health IT impact on oncology care. I think it's a necessary evil, unfortunately, at this point. We want to collect data. We want to make sure our patients, our customers, who are our customers, are getting the evidence-based medicine, which will, we're hoping, lead to better outcomes. So to understand that, to define quality better, we have to be able to collect data, and Health IT is an integral component of that. Now, it's not always the easiest thing to work with. It's not always the easiest thing to get data from, and there are a lot of challenges that we are having in collecting this information and having this data exchange back and forth between the practice versus the payer. But I think if we can come up with better solutions as we go forward into how to understand this, how to get data better, how to measure quality better, I think I think that's where the challenge lies for the next several years.